need to create awareness in stroke. And this is where I think Mr. Arindam, myself, and Mansi come in to try and create awareness to you all about stroke. So, friends, my thought is, that you unlock stroke. Of course, you lock COVID, you unlock stroke, and you stay aware and stay safe is also true for stroke as well, as much as it's true for COVID. So I think it's a very important issue that we're going to talk today. I will follow a little bit of a format which I have found useful, is like a question and answer format, so you would have questions beyond what I will answer initially, which of course you could ask to me and Mansi and to Arindam as well, maybe in the chat box and during the program. So what is a stroke is the number one question which patients ask me. And they try to use the term brain stroke. Actually, there is no term as brain stroke. I mean, stroke always means brain. So even sometimes, the Times of India has made this mistake of writing a brain stroke. But brain stroke is a technical mistake. And I think that's the first thing that I want to point out, that, stroke means brain, always. It doesn't, in a medical term, stroke means brain. Of course, you use it non-medically, it's another thing. Stroke or good luck is another thing. But when we talk about medically stroke, it means brain. And a stroke or brain attack is a block of the artery in the brain. So you have the arteries, in your brain, which are, producing flow. So my left brain is getting blood flow, and that is how my right hand is moved. And similarly, my right brain is getting blood flow, and that's how my left hand is moved. So this arterial flow, if it gets blocked or if it gets ruptured, that's called a stroke. And so you must be aware that this is what is a stroke. And stroke is, of course, as I said, always by medical term, it means brain. It's not used for a non-brain idea. So there's no need to say heart stroke and brain stroke, from that point of view. So pretty well be aware about that. Now, how common is a stroke is a question asked to me pretty frequently. And 1 in 4 in their lifetime will get a stroke. So a very big problem. Wow. 1 in 4 in their lifetime is actually, a very big problem. So, in our listeners also, this includes me as well. We can get a stroke. So stroke is very common. It's a leading cause of death and disability in the world. Number 1 cause of disability, number 2 or number 3 cause of death in the world. And it is mostly preventive. That's the tragedy of stroke. It's mostly preventive. And so that's one of the tragedies that we face, and it's especially preventable in the later age. In the younger age, it may be a little bit more difficult in terms of preventability. The other thing is, you must remember that 14.5 million people will get a stroke in 1 year. That's actually probably more than the COVIDs that you've had in the last 1 year, and so the awareness about it is much less than COVID. And so you need to understand that 14.5 million people will get a stroke in 1 year, and 5 million of them will die. So it's something that, you really need. It's like, I usually say, it's like saying that whole of Mumbai gets a stroke in 1 year. So every population, A to Z of Mumbai will get a stroke in 1 year. So it's a very big problem. And I think such a big problem and such low awareness, thank you, Arindam and Mansi, for understanding that this needs a much bigger awareness and effort. Now, the other question that's asked to me is, how do I recognize that my father or my brother or my uncle is getting a stroke? How do I recognize it? Now, there is an acronym for it, which I would like you all to remember. It's called Be Fast. It used to be fast in the past, but now it has become Be Fast. And Be Fast is a term which you can remember very easily. So Be Fast, Be Fast in stroke, and remember Be Fast. So Be Fast. In the Be Fast, the B stands for balance. That is, if you lose balance, say you're walking, and you see your father or your uncle suddenly losing balance. He's not walking properly, and he continues to do that. That could be a stroke. Be aware, that could be a stroke. The other B stands for balance. E stands for eyes. So if you suddenly lose vision in one eye, or someone tells you, suddenly I can't see the television with one eye, or I can't see the television properly, and especially if he's a little older person, be aware that this could be a stroke. And so E stands for eyes. F stands for face. So, if the person's face is gone like this, this is a stroke. Right now, I'm getting a stroke, and so you should be aware. So speaking, someone goes like this, or of course that could be a stroke. So that stands for the face. The face includes the arm as well. The face doesn't include the arm. For the arm, there is an A. The arm, there is an A. So BEF, A is there. So A is arm really, and arm includes the leg. There's no word for the leg right now, but if you think of the arm, please think of the leg as well. So A stands for arm or leg. That means you ask the person to lift his arm like this, and if his arm is going down like this, it could be a stroke. If he is walking and if his leg is dragging while walking, it could be a stroke. So you need to be aware of the arm and the leg, which is the BEFAST. So A stands for arm, but it also includes the leg. And T stands for time. That means you have to rush to a proper hospital in time. And I must underline the term proper. And I think Mansi will talk to you about this also. Proper hospital means the hospital which has a capability of treating strokes. Unfortunately, all hospitals in India do not have the capability of treating strokes. And you must remain aware about this, friends. I think one of the key things with Arindam can do is actually, make people aware, about hospitals. And I think it's a good idea that, a stroke support group make people aware about the hospitals rather than hospitals themselves. Because hospitals themselves have some, sort of axe to grind in this. But I think the stroke support group doesn't have any axe to grind. And they must, make people aware about the hospitals which are capable of treating strokes. Like in Mumbai, there are definitely 20 hospitals, or maybe even 25 hospitals today, which can treat strokes effectively in all ways. But there would be another 250 hospitals which can't. So I think this is important for the stroke support group to make people aware. And that's why I always insist proper hospital, underline proper in your thinking in terms of stroke. And that's very, very important issue. The other question that's asked to me is, what do you do if you see someone with a stroke? So, just imagine that, I'm getting a stroke right now. My face is gone. My arm is gone, and I'm speaking like that, I'm not scared of Arindam, but I'm getting a stroke. So that can happen. And in one of my, the person I won't name is a big politician, once went to a TV interview, and the TV guy was taking his interview. And so, and he's a very astute politician, because politicians are frequently very astute. But, a very astute politician. And he said, I think the guy who's taking my interview is getting a stroke. And he was. And he was treated in time. And he was a 55-year-old guy. He got back his speech and hand leg because he was treated in time. So I think, this is the importance of knowing that, what to do. What you need to do in very simple terms is rush the patient to a proper hospital. Again, I would underline proper. And I will come to you what you mean by proper as well. You may call an ambulance or take them in a home vehicle or in a taxi. You don't have to necessarily wait for an ambulance to come to you. Because sometimes, ambulance takes, and these days, I think we find that the ambulance takes, 2 hours to come to you, of course. So, yes, the ambulances, are available. But if it is not coming to you in time, if you're in a little remote area, it may be a good idea to take your own vehicle. It may be a good idea to just borrow a vehicle from your friend. Maybe a good idea to take a taxi as well. And rush to the hospital. So try and get to the hospital with whatever vehicle you can. And if the patient is, of course, diabetic, if he's conscious, if he's conscious, he's able to talk to you, and he can tell the, sort of the month and the year to you, you can give him a little bit of sugar. Because, of course, low blood sugar can look like a stroke at times. And, of course, we always will check blood sugar as soon as they come into the hospital. So, this is a question also you should ask your doctors when you take a stroke patient that can this actually be a low sugar? And doctor, do you think this can be a low sugar? Because I think you asking questions is pretty important. And I think stroke support group will make you aware about the questions you need to ask, and you can, of course, be in touch with us. And now the really the $1 million question is that what do you mean by a proper hospital? And this, I think, is one of the key things I wanted to emphasize on you in today's talk. The hospital should have a proper emergency doctor on call. He should have a neurologist or at least a proper MD physician on call, and should have imaging facility, which should be available. CT scan, MRI should be in the hospital, in the center, because time and again I have seen that patients being referred to a CT scan center from that place, which is usually a nursing home, is itself takes more than sometimes an hour or 2 hours to come back, and you may lose the window of opportunity of stroke completely. So it's very important that the CT scan or MRI, that's called the imaging facility for the brain, is available 24/7, 365. So there should be no problem about doing a CT scan or an MRI within 20 minutes in that hospital. And if your time is more than 20 minutes in terms of MRI and CT, please let the stroke support group know and let us know, because I think we need to help you in a better way. And unless you insist on it, I think nothing is going to change. Things change because people insist on it. And I think this is one thing you need to insist, that the MRI or CT scan should be done within 30 minutes. Of course, the hospital should be within 30 minutes of you, 20 or 30 minutes MRI time. And I would say 20 or 30 minutes hospital time traveling should be what you should, sort of keep in mind. So what I want you all to do right now, who have joined me, is, basically close your eyes and think of a hospital north, south, east, west to you, which is within 30 minutes of you, which has a CT scan and an MRI and a reasonably good emergency center. So if I think, north of me, of course, east of me on this side is Global Hospital, this side is Just Look Hospital. Behind me is Leelavati Hospital, and of course, Kogila and Ambani a little far away. But on this side is the sea. So I don't go this side, but I can go this, or this. So I think you need to think about this right now. If you don't think about it right now, during the emergency, you'll go to a wrong center and you may not be treated properly. And you may be not treated properly, because if you lose time, you will lose your loved one's brains. And I think this is very important. So please do that exercise. You may not do it right now, but please do it as soon as myself and Mansi's and Arindam's session is over. Now, of course, there is an app for everything. I mean, there's an app for everything now in this life. You can choose everything by an app. So one of the apps that I would want you to download right now is an app called Stroke SOS. This is an app made by the Indian Stroke Association. And this is an app which will tell you which is the hospital close to you. And you can choose between these hospitals. It'll also tell you that this is a reasonable hospital in terms of time taken to reach the hospital. So, I like to say, I can't do it like Shah Rukh Khan, but like Shah Rukh Khan says, download it now. So download the app now, so that, you can make a difference to your loved one's life in stroke. Now, you must know what are the types of strokes, because, people confuse this in terms of not being aware about the types of strokes also puts you at, makes it gets you into trouble. The reason is there are two types of strokes. The first type of stroke, which is the commonest type of stroke, which happens in 80% of people, is when the blood vessel is blocked in your brain. And that's called an ischemic stroke. So you have a clot going from somewhere, from the heart or from the aorta. The aorta is the big artery which goes up to your brain. It blocks the blood vessel and you lose your hand or your leg or your face, like that. So that's an ischemic stroke. That is one type of stroke. The second type of stroke is where the blood vessel in your brain is ruptured. And that's called a hemorrhagic stroke. And the treatment for these two strokes are quite different. They're quite different. So please don't confuse these two strokes with each other. Be aware that there are two types of strokes, and you need to be aware of these two strokes. And of course, the treatment about in these two strokes will be quite different. So remember that. And so, why do we need to act fast in a patient with stroke? Why is it that we need to rush? Why is why am I saying be fast? The reason I'm saying be fast is that brain gets progressively damaged over time. So if I get a stroke right now, my face goes like this, my hand is weak. My brain is not instantly completely damaged. There's a small area of damage, and surrounding that area, there is a larger area which is dysfunctional, not functional, but not damaged. And this non-functional area can be saved by the proper hospital and by proper doctors uh, in your city and wherever you stay. So it's very important to understand that you can save the brain by rushing the patient in time to the hospital. And this is especially true for that 80% of strokes which are called ischemic strokes. It is less true for the hemorrhagic strokes. But yes, the separation can only be done, definitely by doing an image, either a CT scan or an MRI. And so it's very important for you to rush your loved one immediately to the hospital. So be fast becomes a very important idea. So then comes the question: what is a clot bursting in stroke, and can it be done for everyone? So this is a question people frequently ask me, that my father went to X or Y hospital, and why did he not receive the clot bursting drug that you say? The reason is that the clot bursting drug, which is also called TPA or tissue plasminogen activator, can be given within the first 4.5 hours, uh, but in a selected population. You have to have certain criteria met before you give the clot busting drug. So it's not everyone who comes to a proper hospital who can be treated with a clot busting drug. But if your loved one is not given the clot busting drug, I think it's a good idea for you all and the stroke support group to make people aware. To please ask the doctor, why was the clot busting drug not given to my father or mother or loved one? And I think unless this happens, stroke doesn't move ahead. Unless you question, we don't move ahead. So that's the fact of life. So yeah, definitely ask. But there may be contraindications. Like you don't give the clot busting drug in a patient who's got a very large infarct already well established, because then it produces a hemorrhage and it doesn't really help the patient. You can't give it in the hemorrhagic type of stroke. So the second type of stroke, you can't give it. You can't give it to patients who are beyond 4.5 hours. And so though there is a selection of patients in the clot bursting drug as well. The other question that's asked to me is that, is the window of stroke 4.5 hours only, or has it changed? Yes, it has changed. Now the window of opportunity in stroke is 24 hours. So now, in the past, say 5 years ago, we would say 4.5 hours window or 6 hours window for stroke. And later on, it came to 8 hours window for stroke. Now, luckily, the window is 24 hours. But the 24-hour window is not for the clot bursting drug. It is for a procedure called mechanical clot retrieval in a certain type of stroke, which is called ischemic stroke. Again, it is not for the hemorrhagic stroke. It's for the ischemic stroke, the first type of stroke. It's not for the second type of stroke, which is called hemorrhagic stroke, where the blood vessel is ruptured. It's for the stroke where the blood vessel is blocked. And you can do a mechanical clot retrieval in these patients up to 24 hours. Again, in selected patients, not in everyone. Again, the selection has to be done properly. And that's why I again insist on you: proper hospital, proper emergency, imaging available 24/7, and the fact that the neurologist, the neurointerventionist, the neurosurgeon is in-house in that hospital. And I think this is something that again is very important, that the window is 24 hours now for stroke. So please don't neglect your loved one, and definitely take him to the hospital. Now, after having said these things, what are the risk factors for stroke and how can we control these? The main risk factors for stroke, of course, are blood pressure, blood sugar, blood cholesterol, sedentary lifestyle, and heart rhythm disturbances. So I think, these are things which, I would recommend everyone to, after you are 50 and even at 40, I would say, please check your blood pressure, your blood sugar, your cholesterol. Take a walk half an hour every day. I struggle with my family for this, but luckily they still continue to listen to me. And also heart rhythm disturbances. So like palpitations, you're getting, then it's a good idea to tell your doctor. So these are some of the things. The other thing I want you, this is the days of app. So there's another app that you can download for stroke. This is called the Stroke Riscometer. And this is from the World Stroke Organization. So the World Stroke Organization has a stroke riscometer, which you can download. Download it now is a good idea, and keep it with you. It tells you your risk of stroke in the next 5 years, in the next 10 years, and I have downloaded it for myself as well. My family, of course, will not do the stroke risk. They're not interested. They say, go away, Shirish. We don't want to check all this stuff. You do it for yourself. So I did it for myself, and I have a 4% risk of getting a stroke in the next 5 years. So I think we are not. No one in this life is completely exempt from getting disease. So never think yourself as come with some sort of a complete protection from disease. There's no such thing as complete protection from disease. So remember, friends, even if you have taken the vaccine, have taken the second jab, and you're beyond 15 days, so scientifically, you would say I can do anything. Not true. It just prevents 70%. So if in a very simplistic way, if there are 100 people exposed, 70 will not get, 30 would get. But otherwise, if they're 100% exposed, 70 would get and 30 would not. So it just reverses the numbers. And it doesn't say that you're fully protected. I mean, there's no such thing as full protection in medicine. But that is good enough to change our COVID risk from 10 million to 1 million, and then from 1 million to 1 lakh, and then from 1 lakh to 1,000 over 6 months, not over 6 days. So I think a similar thing is true for stroke as well. So you should remember that this is a risk reduction idea. Now, as I like to say that wearing a seat belt doesn't mean that in an accident nothing will ever happen to you. But if you wear the seat belt, you are better protected than not wearing a seat belt. So I think the similar is for the vaccine. It's like wearing the seat belt, in the COVID drive of life, and nothing else more than that. So what are the treatment options in a stroke? As I said, ischemic stroke, you have IV thrombolysis, which I told you about. You have the mechanical clot retrieval, which can be done in the first 24 hours. And of course, you have to treat the infection. If your person gets an infection, you have to treat the dehydration. You have to sort of treat the electrolyte imbalance. You have to treat the blood sugar control, BP control. You have to prevent clots in the legs. And these are some of the things that, you could do. Have to be done. So you should ask your doctors, are these things being done for your loved one in the hospital? In the hemorrhagic stroke, of course, the neurosurgeon is more important, and surgery is, if required, can be done. And except the clot bursting drug, everything else can be done. And during the COVID times, I just want to make that in the COVID times, people hesitate to come to the hospital. And, but it's very important for you to remember that with a stroke, please remember that the stroke has a 20% risk, a mortality risk, whereas COVID has a 3% mortality risk. So you are facing a much higher risk disorder. It's not the same risk. You can't weigh stroke and COVID in the same bag and think that I won't go to the hospital because my father might get a COVID, and how will you prevent it completely? And you are admitting COVID patients, so how will I know? Now also remember, friends, that the COVID risk in the hospital is very, very low. I mean, it's even lower than going into a cab or going into a into Uber or an Ola. It's a very low risk. I think out of the last 700 or 800 patients in whom we looked at in the emergency, there's probably one patient who was a kidney transplant patient, got COVID. He already had gone to a lot of dialysis centers, so we don't know where he got it from. But 701 is nothing. So please don't stay at home after a stroke and rush to the hospital. We will look after you and of course prevent you from getting any COVID or any infection. So how do you cope with life after stroke? So around 80 million people will live with stroke in the world. So it's very important for you to also know that rehab is very important in stroke. I have not spoken about rehab too much because I think we can take it in the question answer after Mansi. Stroke affects how you think, talk, move, feel. So it's very important for you to do physiotherapy, speech therapy, occupational therapy, and do not miss the biggest thing, which is depression in your stroke patient. So definitely, I ask my patients always, I hope you're not feeling depressed. I hope you're eating, sleeping well. I hope you're having your food well. And because, lots of times we doctors, do not ask patients about depression because, they themselves feel depressed if they ask too many depression questions, so, but be aware that, someone is smiling. I see that's good, So, depression is a very important thing. And then, of course, there's a post-stroke checklist, which I will just go through quickly so that Mansi has time to talk to you. The post-stroke checklist is something you can check on there. Just Google and check it. It's on the World Stroke list. So go through the post-stroke checklist. It says, are you getting the stroke prevention medicines? Or are you getting the antiplatelets like aspirin, clopidogrel? Are you getting if you required, you may be getting an anticoagulant, which can be warfarin, rivaroxaban, apixaban, anti-cholesterol drugs. Are you getting the antihypertensive? Are you getting the anti-diabetics if required, of course? And then how is your activities of daily living? How is your mobility? Are you getting any spasticity? Spasticity means, stiff hand or leg like that. Pain, if you're getting pain, definitely talk to your doctor if you're getting pain. If your loved one is incontinent, if there's a communication problem, mood, of course, as I said, depression is very important. Cognition and thinking, life after stroke, family relationships, and caretakers. Caretakers also burn out with stroke, so it's very important to ask this question about caretakers. So I think just a short story before I end, which is that the first stroke I treated with a thrombolytic agent was 20 years ago. One lazy Sunday morning at 9 o'clock, I receive a phone call. I'm having breakfast with my family. I receive a phone call that a 45-year-old guy has lost his left hand and leg. What do we do, doc? Is there any treatment? I rushed to the hospital, and this drug TPA had just come in. It was not yet probably one of the first 10 guys to be given in India. The drug, I had just read about it. I had never used it. So I go to him and I talk to his young wife, that, can we give this drug? There's a small risk of bleeding in the brain. She says, no, doc, I'm a little bit dejected that this patient is refusing. I go back and, before I walk out 5 minutes later, she comes back with tears in her eyes. And she says, doc, I think you look like a sincere guy. I would believe you, give it. And so I said, okay, let's go ahead and give it. So I give it and nothing happens in an hour. And, I'm again depressed and feeling negative, work 10 years in stroke and nothing can be done. And then I go up to see my patients in the wards. And, those days, there were those old mobile phones with that thing you had to pull out and hold the phone like that, like a huge, like a hatoda, so to say, like a hammer. And on that would come SMS. So he had SMS'd me, doc, my left hand is working. I'm SMSing you with the left hand. And I think that was the best SMS I had received in my life. So thank you, friends. And I think I hand over to Mansi for her talk. Thank you.
Thank you, Dr. Hastak. We'll take the set of questions later on. First, let us welcome Mansi. Mansi, over to you. I will start by asking, how did you have this stroke, and can you please share your journey as a stroke patient and a stroke survivor?
Thank you, Arindam. It was a pleasure listening to you all, as always, Dr. Hastak. And guys, just to let you all know, Dr. Hastak is the one who saved me from everything. And I am today as I am because of him. So this was around 7 years ago, 2014. Fortunately, I want to talk about awareness, like even Dr. Hastak said. We cannot harp enough on awareness, not just about stroke, about diseases. Be vigilant about what's going on around us all the time. Like I knew I was drooling suddenly out of nowhere. It was 9 a.m. in the morning. And I was like, okay, I got a stroke. I told my husband. And my husband just stared at me blankly. I said, I've lost my mind. He said, what do you mean? I said, Ashish, I am drooling. I know I am controlling my saliva. Now, only because I knew that drooling, where we have no control over our saliva, means stroke, because means the brain, something to do with the brain, was I able to help myself. Believe me, guys, I was the one who rushed myself to the hospital, not my husband. My husband said, our neighbor is a doctor, very, very close friend, and a very senior doctor at Leelavati. He said, I'll go call Dr. Sanjeev. I said, no, Ashish is my husband, as you can make out. I told him, no, we need to be in an ER, in an emergency room. The doctor can do nothing for me. Like Dr. Hastak said, you can't harp enough about the right hospital to choose. Fortunately, I live in Bombay and I live in Juhu, which is extremely close to Ambani. And we rushed to Ambani. I was the one who rushed to Ambani. My husband was still at a loss. And of course, Ambani, once we were there at the emergency, there was no looking back. Dr. Hastak was called. Uh, he was there. My good luck, my fate, I would say. He was there literally in Ambani for a year, doctor, I think, if I remember, just for 1 year. It was as if he was sent for me, but I was taken into the MRI. I had a clot. And when I was supposed to be thrombolized, doctor obviously had a question, because like he mentioned, there is the side effect could be internal bleeding, that is hemorrhage. And I said, I want to sign the waiver form, because I said I'd rather die of internal bleeding than be a vegetable and live on death. But Dr. Hastak was like, no, you cannot do this. We need a family member to sign the form. Whatever, that happened. And I survived. I was in the hospital for 5 days for all investigations to happen, to know why did the stroke happen. And we found out that it was because of a hole in the heart, which I was born with. I was not aware. I never ever got any symptoms. But with all the investigations, of course, I went through the ASD closure, it's called, where the hole in the heart was closed. And that was a decision which I took, because though Dr. Hastak also told me that the reason 100% may not be because of the hole in the heart, but there is always a backflow of unpurified blood which could be carrying a clot. So I chose to get that out of my way. And I've been on a blood thinner since then. So one thing is awareness, which I spoke about, which we really need to know about people around us, like Dr. Hastak said, that, what is exactly going on with us and the others, and act quick, be swift about it. It's very important. We cannot talk enough about it. One more thing which Dr. Hastak pointed out to me, I did not know this, did not realize it. I've always been a fitness enthusiast since a long time. I'm a dancer, I'm an Odissi dancer. So I was always into fitness. And the day I was being discharged, I can't forget, Dr. Hastak just pulled a chair and sat down next to me, next to my bed. And he said, 2 things saved you from the stroke. One was the quick action which I took, like he said, like within 2 hours, but I was there, I think within half an hour or an hour of my stroke, I must have been thrombolized. And the second thing was fitness level. Yes, everybody heard it right. It is fitness levels. Because all my parameters were so good, all under control. I was going to turn 40 that year. So you can say I was 40. In a couple of months, I turned 40. And the resilience of my body to get back to normal was at a different level, and mentally. When doctor told me to straighten my arms to see how bad I was, my legs, I was like, come on, I do this all the time. I have enough strength in my muscles to do that. I don't need a mind to do that. For me, it was like just muscles doing it. So what I'm trying to say is fitness is really, really important at all ages. So when we talk about, there are lots of people who actually tell me, kya fayda hua? Wo 40 ka tha, treadmill pe chala gaya. What was the use? I was like, maybe he lived till 40 because he was fit. He could have passed away at 30 if he did not at least have that kind of fitness level. So we can't harp enough on fitness levels. And one very important thing which I had to overcome was fear. Like doctor said, which can, of course, lead to depression. That is just one thing, but can lead to functionality, a problem in function. I remember after my stroke, when I had to travel for the first time, I was so scared. I have traveled very often in my life. But when the first time I had to travel, the first thing which came to my mind was, what if I get a stroke when I'm in the flight? What will I do? At home, I could rush to the to the hospital. But I had to really work on myself, on my mental state, for which I totally would suggest therapy to all of us. We all need it constantly. Therapy, when I say apart from the physiotherapy, the speech therapy, those are all physical needs. But for the mind, to get strong once again, emotionally and mentally, thinking that no, you will get back to normal. And that belief is very, very important, guys, that you will be back to normal. That conviction, and then to keep taking steps forward, only way forward. That's the only way that should be. So we cannot be fear oriented, which is a very normal thing to happen. I really wanted to talk about that because I know I went through that personally. It wasn't easy to overcome that fear. It was just unfortunate that my brother got cancer, for which I had to travel for the first time. And that was what motivated me to travel, which is not the right reason to be motivated. But yeah, we can get very fear oriented, which we need to break barriers. And I would totally suggest psychological therapy if we need, which I think we need. So in the support group, that's a big help, I think, doctor. I would think, that's a big way we can help each other with. And of course, to get back to normal, it's all the same, whatever doctor spoke about, which I did diligently. Rather, from my ICU, I started my exercises, the flexing of my ankles, my arms. Like I said, because I was into workouts and exercises, I started doing that. But it's so important to keep doing all of that, along with, of course, diet, which we all realize. I think we all know. Problem is, only awareness does not help. We need to execute in our lives. I'm sure Dr. Hastak knows what I mean, because when you are a part of a family where you know what the other person is doing is wrong and still can't do anything, it's so frustrating. It's so frustrating, because when your loved ones don't listen to you, but whatever we can do is just keep inspiring people and keep at it. And I think one more thing which doctor just mentioned about one senior citizens, the scare of going to the hospital when you get a stroke or any other problem because of COVID. I have a very, very close friend. His dad just recently got a stroke. He's 83. He was admitted to a hospital for stroke and he did get COVID there, but he survived both and he's back home. So just to let everybody know that first thing is that stroke we need to address. COVID can be taken care of. So these are a few points which I thought were relevant to share. And of course, if anyone wants to know anything more, is more than welcome to ask me. Thank you so much for this opportunity, doctor. Thank you.
I think excellent. Mansi is a very strong person, so you can ask her questions. And she'll answer that. Excellent, Mansi. I think you have your recovery and the way you have sort of. I think it helps other stroke patients. They want to get in touch with you, maybe to talk.
Absolutely, it will be a pleasure. And I am now a health coach because this journey of mine over the last 7-8 years really pushed me more into the field of health. And I'm a certified health coach now, so I will be more than happy to help.
Excellent talk, excellent recovery also. And we saw your guts.
Thank you. Thank you so much.
Yeah, great. Okay, so do we take the question?
Yeah. First question I would like to put to
Can we put the question in the chat box so that I thought that we could answer from the chat box. Maybe easier, no? Sometimes we can't hear the question.
Your stroke. Very
Arindam, do you think we should take from the chat box because the sound is not great at times?
Yes, is it my internet or is it? Or I think Arindam is frozen for all of us. So
even I could not hear what question he's asking.
Right.
So can we go through the chat box? I guess then.
Yes, yes, sir.
Yeah.
Yes.
Okay. So the first question here is this first one is in the fast. Be fast. I think I forgot the S. So S stands for speech, and so be fast is B is of course balance. E is eyes. So if you lose balance, if you lose vision or eyes, and F stands for face, and A stands for arm, and it includes the leg, and S stands for speech. And I think I forgot the speech. So in my speech, I forgot speech. So speech. So if you lose your speaking ability, or go, to the then S. And T, of course, stands for time. Russian time. So be fast is the acronym that we want you to remember to be aware about stroke. So yes, so that's one. The other thing is, yes, thank you so much. Yeah. Yes, stroke survivors need to be encouraged continuously for rehab and physio. It's very important to continue it for over longer periods of time. Of course, the stroke can be mild, moderate, severe, depending on what is, and sometimes the stroke doesn't recover in 6 months to a year as well. But I think rehab and physiotherapy should continue because it maintains the joints, it maintains the muscles, it maintains your body physique, and it maintains the system for recovery. Yes, of course, spasticity can be managed in different ways, and we recommend Botox injections to patients who have spasticity. So now the next question is: do we have stroke-ready ambulances? We have heard of stroke-ready hospitals are ambulance-trained staff to recognize stroke. What can they do if they are transporting from a far place? Yes, what we have tried to do ourselves is that in Mumbai, we have called the ambulances, the ambulance service of Mumbai, and we have trained the doctors who go with the ambulances for stroke awareness. In fact, we did a program for 40 doctors just pre-COVID, and then COVID hit us badly for all programs, because but we did a program and tried to get the ambulance staff trained for stroke. But of course, we need to do more of this, and stroke support can be another way to train the ambulance staff to recognize stroke and also to bring patients of stroke quickly to the hospital. And one of the things that the ambulance people can do is, of course, send a SMS or send a WhatsApp message, to the hospital before the patient comes in, so that the hospital is ready to receive that patient and keeps the MRI or CT scan sort of offloaded for that patient. So that is some of the things that we have attempted, we have done for our patients. So that's one side. Yes, we don't have clear-cut stroke-ready ambulances, but we have tried to train in Mumbai. We have tried to train through the Mumbai Stroke Association. We have tried to train the doctors who go in with the ambulances. My father. Just one second. My father was told to go to Medanta because hospitals generally would take time for wise paperwork, so can't they act immediately? Yes, this is a problem that we face, and I must confess that this is again a part where the stroke support group, and we must fight this issue. We have ourselves sort of, bypassed this issue and get our patients admitted without going through the rigmarole of all that paperwork. But yes, the other side is that the paperwork can go tandem with the treatment. It's not necessary that the treatment has to stop because the paperwork was not done. But of course, we need to act on this. All hospitals are not the same. And in India, of course, we have a very variable hospital scenario. So you would have also seen this yourself. It is at all levels, and of course, we have asked the World Stroke Organization and the Indian Stroke Association to try and certify hospitals through them, which is an ongoing program right now. But yes, we need to get these things better done. What step can we take against hospital if someone reached on time and the hospital recognized that TFB did not provide treatment, and again that the person got another stroke? Yeah, I think this is an issue which it's not a question of taking against the hospital. I think it's a question of taking against the system. The problem that we face is that this system is not properly geared. So I think it has to be in terms of the government, the legislation, and everything to be done in the system. The Indian Stroke Association is trying to do that, but is limited by its funding and its availability, because trying to certify a hospital means you have to go to that hospital, inspect it every year, and then say that this is a stroke ready hospital or this is not a stroke ready hospital, and it does involve a lot of effort and a lot of this thing. I think this is something that we should take up and advocate the government to do regularly, and of course the Indian Stroke Association can help the government so long as the government comes in with this. It will probably be done, but I hope we do it quickly rather than later. What we can, I'm sorry. How do we, other questions? Can you ask me some more questions? Yeah.
Yes, sir.
Tamanna. Yeah.
Yes, sir. Sir, other question is that the stroke SOS contains government hospital as well?
I think so. It does. Now, to be honest with you, I have just checked it to see that it contains hospitals. But it's a good question, and I'm sure it does because it's set up by the Indian Stroke Association. If it doesn't, please write to me, whoever has asked that question, or write to Tamanna, or that we need to rectify it. It is set up by the Indian Stroke Association, so I think, but you can check it out.
Yes. So next question is, how good are the rehabilitation services in our country?
Yes, the rehabilitation services in our country certainly need to be, to be sort of brought up. The problem with rehab is always that the problem is that it's very hard to see, events that take place over a long period of time. The acute stroke treatment, like Mansi said, you give the injection with this arm and the other hand starts moving up. That's easy to see. But if it takes you 1 year to lift up your hand, it's very difficult to see. And if it takes even longer, it's even more difficult to see. So the problem with rehab is, it needs longer time, it needs it needs more resources, and it needs, sort of dedicated systems for rehab. And, we do suffer from lack of dedicated rehab centers in the country. I'm sure there's a big need for that. And I'm sure that, we need to, do more in this terms. The problem, of course, is that, it's also a question of resources. It's a question of resources. It's a question of time. It's a question of caregivers, sort of putting in big effort. But I would say it's still worth it. And it does make the patients, sort of come out and do well. There is a little bit of an issue, which I always tell my patients, that please don't focus on complete recovery. I mean, please don't say that unless my hand comes back, I'm not going to do anything. This guy who says I'm not going to do anything till my hand recovers actually can do a lot of things with his right hand, but he stops doing the things with his right hand as well, as if his right hand has also stopped working. So he puts his life on hold, and so this happens. And it's called, Dr. Kaplan, my teacher, used to say rehabilitation syndrome, which says that, you should go back to normalcy before you start back your life. There's a lot of life that you can lead without completely being normal. I had a top doctor who was a radiologist, and he had lost both his hands and legs. It was not because of a stroke, but it was like a stroke. And, he was the best radiologist in Nagpur, because he could read the x-rays like, black and white. And he was asked for all opinions, and he led a great life. So it's not necessary that we have to have everything in life to be happy. You don't have to have everything. And I think this is the thing I tell my stroke caregivers as well, that sometimes you have to not focus on just the hand recovery or the leg recovery. You have to sometimes focus on what you have as well, rather than completely focus on what you don't have and say, unless I have this, I'm not going to use this. And so I think it's very important for us to, get this idea also out there. Because if you have 80 million strokes in this world, there are going to be 20 million people in this world who are not able to, walk or go to the bathroom and do that. And those 20 million are also worthy lives. They're not non-worthy lives. And because we start thinking here that they are non-worthy, and that's what creates a lot of problems. I think, every life is worthy and it can be led well if you make a decision to lead it well. And so I think this is very important for stroke, people. And of course, the rehab people continue to help a lot of, patients. So I'm very happy about that. Yeah, can we make a part of NAPH for certifying stroke-ready hospitals? Yes, we have attempted to do that. We have attempted to do it through the Indian Stroke Association. Unfortunately, it has not worked as yet, to tell you honestly. We've asked the World Stroke Organization to also certify, hospitals in terms of stroke. They have put forward certain stringent guidelines, but the problem with the World Stroke guidelines is sometimes they are too stringent for Indian situation. It's like saying, every guy in India who has COVID must live with a different bedroom and a different bathroom and a different, it's like asking too much from the system. So, but I think, yes, we have put forward that idea. It hasn't worked as yet, but I'm sure if you people put in your voice, it will work.
Yes, sir. So, one of the question is that neurologists are mainly available in the cities. So
Sorry,
the
Tamanna, can you
person,
speak a little loudly?
so yes, neurologists are mainly available in the cities. So in the small towns, how will be able to people can recognize stroke, and if it's there a primary care emergency protocol for the stroke patients that primary care physicians who are working there can follow.
Yes, I think it's an important question that, what do you do to a patient who gets a stroke in a village or in a small center? It is a question which is difficult, at this point in terms of two things. One is, yes, you can give an aspirin tablet to a patient with a stroke without worrying whether it's hemorrhagic or ischemic, because a single aspirin tablet a little bit helps an ischemic stroke and doesn't worsen the hemorrhagic stroke. So that's one of the things that is possible, not recommended by the World Stroke Organization or by the guidelines in terms of the doctors. But sometimes you have to work beyond the guidelines because India lives a lot beyond medicine as well. So that's one thing. But other than that, probably not bringing down blood pressure too rapidly, but bringing down the blood pressure to reasonable levels. Like if it's a very high blood pressure, bringing it down to 140/90 would also help. And of course, giving the sugar to this guy in the village who has a diabetes, also might help. And trying to get him to a proper center will help. Of course, having said this, some of the small town doctors and who are not neurologists, and one of them small centers beyond Pune have done incredible work with just physicians, no neurologists, and incredible work with thrombolysis and with doing thrombolysis in their centers. So I think passionate people will make a difference, and I'm sure they will transform systems if you all also ask for them. I think that's one of the things that I always say, that it's the customer who determines what is the quality of goods available in the market, because the customer must ask for better goods, and I think better goods will be delivered to the market. If the customer is not aware and is not aware and is not interested in things, then things don't change. So I think the stroke support group is a great way to build a system and help a system, nudge a system, not push. If you push, system breaks. You have to nudge the system. So you have to nudge the system into better stroke care. So I think you all can do that by creating awareness.
So, like,
Thank
one
you.
last question, like, is
Yeah.
there any stroke helpline through which if patient know that if a patient is getting stroke or symptoms they are recognizing, so they directly can call on that helpline number and they can reach to a stroke ready hospital?
As yet, no. We did attempt. Sometimes you do things and then you realize how difficult they are. Until you do them, sometimes you think they are easy. We did set up a helpline, some years ago. The problem with the helpline is, of course, that, it needs continuous monitoring, and, it needs continuous awareness, and it needs continuous, sort of expertise, because the questions asked on the helpline may have nothing to do with stroke at times. And so you need a helpline, where the all questions are answered rather than only stroke, because only stroke helpline is difficult in terms of running. And so we had once suggested that it can be a stroke heart helpline, where you have stroke and myocardial heart attack, which are the commonest emergencies. But then there are other emergencies like head injuries and fractures and unconsciousness, seizures, and so on. And somehow we haven't been able to do that. It's a good thought. I don't think, if you are aware of it, please let me also know. The person who asked that question, if you are aware of any helpline, please let me know. There are ambulance services available, but I don't think that there are clear-cut helplines as yet.
Okay, sir. Thank you so much, Dr. Shirish Hastak and Mrs. Mansi, for your taking out your time in this webinar. Everyone have given good comments on this for an informative session. Thanks a lot, sir. We are looking forward to connect with you more sessions like this, so that everyone in the community should know that what stroke is and how it's important to take a step on it. Thank you so much, sir. Thank you so much, ma'am.
Thank you, and thank you, Mansi, for a great session.
Thank you so much. Thank you. Pleasure.
Bye. Bye. Thank you.
Thank you, sir.
Thank you, Arindam, and thank you for organizing the meeting. Thank you, Tamanna.
Thank you, sir. Thank you.